My name is Dr. Mark Litzow. I am a hematologist at the Mayo Clinic in Rochester, Minnesota. And I want to tell you today a little bit about a clinical trial that I led using Blinatumomab. And Blinatumomab is a bispecific T-cell engaging molecule. It takes the variable region of a antibody that reacts with a protein on B-cell acute lymphoblastic leukemia cells called CD19, and it's linked to an antibody that reacts with a protein on some immune cells called T cells or thymocytes, and it brings the T cell in close proximity to the leukemic cell and kills it. And this was actually developed about 10 years ago and was found to be beneficial in patients where their leukemia unfortunately had come back after chemotherapy. And it was found to be effective in that setting. And then we also studied it in patients where they had low levels of leukemia, what we call measurable residual disease, and was found to be beneficial there. So in this clinical trial that I did, we added it to chemotherapy in patients who we thought had a good prognosis. They were in remission and their measurable residual disease testing was negative, so they were MRD negative. And what we did was we enrolled 488 patients, and they went through several months of chemotherapy to get into remission. And then at that point, if they were measurable residual disease or MRD negative, we randomized them to either continue with what we call consolidation chemotherapy to consolidate their remission, or we added Blinatumomab to the consolidation chemotherapy. Blinatumomab has to be given by a intravenous infusion daily for 4 weeks. And so that's one cycle. So it's a month of treatment, then they get a 2-week break and get another month. And we gave 4 cycles of this Blinatumomab. And what we found was that the patients that got Blinatumomab plus chemotherapy had a much better survival than the patients that got the chemotherapy alone. At 3 years, survival was 85% for the patients that got Blinatumomab plus chemotherapy and 68% for the patients that got chemotherapy. And as a result of this, the FDA approved Blinatumomab now for MRD negative patients. They kept the indication broad and said for consolidation chemotherapy to add it to consolidation chemotherapy. And I'm here at the European Hematology Association meeting in Milan, Italy, and we're presenting some data from a subset of patients from that study. And these were the younger patients on the study because we enrolled patients between the ages of 30 and 70 on this clinical trial, this E1910 trial. And so we're looking at this meeting at the patients that were between the ages of 30 and 55. And we found that particularly in these younger patients, Blinatumomab was very effective. So at 3 years, their survival was 92% versus 67% for patients that got chemotherapy. And we also looked at the patients between the ages of 30 and 40, and they had 100% survival with Blinatumomab versus about 70% for the patients that got chemotherapy. So we're very encouraged by these results, and we think that this is going to allow us to use more immune therapy medications like Blinatumomab and some other ones, and allow us to reduce the amount of chemotherapy we give in the hopes that we can lessen some of the side effects that patients experience and yet continue to improve their remission rate and survival.